Welcome to this explainer. Look, if you've recently been prescribed cyclophosphamide, it's completely natural to be feeling a bit of anxiety right now. I totally get it. It's a really potent medication, and yeah, it's often associated with chemotherapy regimens. Hearing that word from your doctor can be incredibly overwhelming, but let's just take a deep breath. Today, we're going to take that anxiety and turn it into empowerment. We're going to walk through a super clear step-by-step guide to your treatment so you know exactly what to expect.
Here is our roadmap for today. First, we'll meet your new medication. Second, we're tackling lupus and vasculitis. Third, we'll look at how the medication actually works. Fourth, protecting your bladder and fertility. And finally, number 5, your essential blood work and monitoring.
All right, let's jump right into Section 1. Meet your new medication. What exactly is cyclophosphamide?
So, cyclophosphamide is a potent immunosuppressive medication. It's an alkylating agent, and it's typically reserved for severe autoimmune diseases. Now, its history is actually really fascinating. It evolved from early pharmacology and, believe it or not, compounds related to chemical warfare back in the World Wars. Because of those intense origins, it's historically been viewed as this sort of double-edged sword with pretty high toxicity. But here's the good news. Modern medicine has completely transformed this drug. It's gone from a blunt instrument to a highly refined, life-saving rescue tool.
Treatment has honestly become so much safer over the years. See, in the past, patients often took daily oral pills. And sure, that resulted in continuous immunosuppression, but it also meant a much higher cumulative dose of the drug building up in your body over time, which meant way greater toxicity. Today, things are different. We favor modern intravenous, or IV pulse therapy. This uses approaches like the Euro-Lupus protocol. So instead of taking daily pills, you get the drug via an IV infusion every few weeks. This means your total cumulative exposure is much lower, dramatically reducing your risks, all while still giving you that incredible effectiveness.
Moving right along to Section 2, tackling lupus and vasculitis. Basically, the why behind the prescription. Take a look at this quote straight from our medical sources. It says cyclophosphamide, quote, transform these diseases from often fatal illnesses into treatable conditions, end quote. I really want to emphasize this because I hope it brings you some serious comfort. Before this drug came along in the 1970s and 80s, conditions like severe vasculitis had absolutely staggering mortality rates. So this validates that your doctor isn't just prescribing this lightly. No, this drug is a necessary, highly effective rescue therapy for major organ-threatening crises, like when lupus is attacking the kidneys. Think of it as the heavy artillery. It's brought in when gentler medications simply can't act fast enough to literally save your organs.
And the reason it acts so quickly and effectively, well, it targets very specific components of your immune system, your B lymphocytes and T lymphocytes. By hitting these fast multiplying immune cells, it suppresses them rapidly. It's essentially slamming the hard brake on that massive, runaway inflammation happening inside your body. And that gives your organs the crucial chance to begin healing from the autoimmune attack. All right, Section 3, how the medication works. This is all about the prodrug mechanism. This is actually a very elegant process. Cyclophosphamide is what scientists call a prodrug. Here's how it works. Step 1. The inactive prodrug enters your bloodstream. At this point, it actually can't do anything at all. Step 2. It travels to your liver, where specific enzymes known as CYP450 act literally like a key turning in a lock, activating the compound. Then, Step 3. The newly activated drug spontaneously splits into 2 completely different molecules. So the liver separates the drug into a life-saving tool called phosphoramide mustard and, unfortunately, a toxic, irritating byproduct called acrolein.
Let's focus first on the helpful part of that split. Phosphoramide mustard is absolutely the hero of our story here. This is the active agent that seeks out those abnormal lymphocytes we were just talking about. It binds directly to their DNA, completely prevents them from replicating, and then triggers apoptosis, which is just a fancy term for programmed cell death. This right here is the exact mechanism that halts the autoimmune attack and starts pulling you back into remission.
Which brings us to Section 4, protecting bladder and fertility. This is all about taking control of those side effects.
Now, what about that harmful byproduct, acrolein, that we just mentioned? I want to empower you with exactly what you and your medical team can do to manage it. You see, every potential side effect has a modern mitigation strategy. You are never helpless during this treatment. First up is hemorrhagic cystitis. This is severe bladder bleeding caused by that toxic acrolein gathering in your bladder. The mitigation? A medication called Mesna. Mesna actually detoxifies the acrolein, and it's paired with aggressive hydration. Second is infertility, which is caused by gonadal damage. The mitigation here involves using GnRH agonists like leuprolide to put your ovaries into a protected resting state alongside options like egg or sperm freezing. And third, infections. These are caused by lowered white blood cells. The modern strategy here is taking prophylactic antibiotics like Bactrim to actively ward off specific pneumonias while your immune system is suppressed.
I really want to double down on your active role when it comes to bladder health. Since acrolein concentrates in the bladder and causes chemical irritation, you have to get it out of there as fast as humanly possible. How? Through aggressive IV or oral hydration and frequent urination. You are quite literally physically flushing that toxic acrolein out of your system. So drinking plenty of fluids, it's not just a nice, healthy suggestion here, it is an absolute requirement of your treatment.
And there is a profound clinical reality we need to talk about, particularly for young patients. Cyclophosphamide can cause premature ovarian insufficiency, basically early menopause, and reduced sperm production. Because of this, fertility preservation discussions and strategies absolutely must occur before starting your treatment. If you're a young woman with lupus nephritis, for example, protecting your future family planning with egg freezing or ovarian protection is a vital, proactive step you need to take right now before that first dose.
Okay, Section 5, Essential Blood Work and Monitoring. Let's look at your safety checklist.
Before you even begin, your doctor is going to order baseline blood work and screenings so they know exactly where your body is starting from. This includes a complete blood count, or CBC, to check your white and red blood cells. You'll also get a comprehensive metabolic panel, a urinalysis to check your bladder's baseline, a pregnancy test if that's appropriate, and infectious disease screenings for things like hepatitis and TB. Then, once you actually start treatment, you'll likely have a CBC drawn every 1 to 4 weeks initially. This isn't optional, it's mandatory to ensure your bone marrow suppression doesn't lead to dangerously low white blood cell counts, which of course invites infections. Your team will also continuously check your creatinine, your liver enzymes, and do regular urinalysis to monitor for hematuria, which means blood in your urine. Trust me, you are going to be watched incredibly closely.
And I want to reassure you that your medical team is constantly doing the math on your total exposure. Long-term risks, things like bladder cancer or other secondary malignancies, correlate very strongly with the cumulative lifetime dose you receive. Because of that, your doctors meticulously track every single milligram. Their goal is always to use the lowest effective dose for the shortest amount of time possible, keeping your long-term risks incredibly low.
Finally, our conclusion, a bridge to long-term health.
To wrap up our explainer today, it's worth pointing out that while modern rheumatology has shifted heavily toward newer drugs, like rituximide or mycophenolate mofetil, cyclophosphamide remains an irreplaceable, highly effective rescue therapy. Think of it as a temporary bridge. It's designed to pull you out of a dangerous crisis, get you safely into remission, and then hand you off to those gentler maintenance drugs for the long haul. So I want to leave you with this final provocative thought. How will you partner with your rheumatologist to make your rescue treatment a success? From aggressively hydrating to showing up for every single lab draw to having those proactive conversations about fertility, you are a powerful, informed participant in your own healing process. Thanks so much for joining me today, and here's to successfully navigating your treatment.